okay?
I think it's broken.
Oh no.
Radial-ulna fractures are usually caused when a child falls on an outstretched arm. The impact of the fall can cause several different types of fractures, but the most common is a green stick. A complete, which is the bone being divided by a break, a plastic deformation, which is the bone being bent and causing a microscopic fracture line that does not cross the bone, or a buckle, which is a fracture on the tension side of the bone and causes a buckling or raised area on the other side. This type of fracture is usually found in school-aged children, adolescents, and elderly adults. There are several differences that affect fractures seen in children. More porous bones allow the bone to bend instead of break. The periosteum is thicker so the bone may not break all the way through. Epiphyseal lines may cushion a blow so the bone doesn't break. And healing is rapid as a result of increased bone growth. Complications: stunted growth or malgrowth due to damage to the epiphyseal line, fat embolism due to fat mobilization in the vascular system, compartment syndrome due to increased swelling causing insufficient blood flow to the extremity, and also infection due to pathogens entering the vascular system. A fracture is suspected when a child presents with obvious deformity or shortening of the arm, swelling, or pain. A fracture is confirmed with an X-ray. Treatment: realignment, open or closed reduction if needed, and immobilization with a cast. Medications that are typically given for fractures to treat pain include non-opioid and opioid analgesics such as Tylenol and morphine. Tylenol, a non-opioid analgesic, is usually given for mild to moderate pain. Children under 12 will require reduced dosages based on their weight and age. Side effects include rash, urticaria, hepatotoxicity. In case of overdose, take the child to the emergency room and acetylcysteine can be administered. Morphine, an opioid analgesic, is usually given for severe pain. Children will also need a reduced dose based on weight and age. Side effects include confusion, drowsiness, respiratory depression, hypotension, and constipation. In case of an overdose, Narcan can be administered. Cast care. Some do's and don'ts. Do's: dry cast thoroughly after exposure to water. Do this by blotting dry with a towel, or use a hair dryer on the lowest setting. Move joints above and below cast regularly. Elevate extremity above level of heart for 48 hours. And report to healthcare provider if you experience any of the following: increased swelling with discoloration of fingers, burning or tingling under the cast, and sores or foul odor underneath the cast. Don'ts: you should not get your plaster cast wet. You shouldn't remove any padding. Do not insert objects inside the cast. And don't cover the cast with a plastic bag for extended periods of time.